these kind of same symptoms and you're thinking like, oh, it's because maybe my sugar's high or because maybe XYZ, do you recommend them going and asking their doctors to check for different ailments, or how should they handle that?
That's a very, very good question. And I think the element that we can talk about here is new, is what's new. Is there something different? I think that having diabetes can definitely, diabetes and elevated blood pressure can cause a lot of symptoms, you know. My father, just speaking of personal experience, my father doesn't take care of his blood pressure as much as I would want him to, even though I'm really like trying to get him to. And he basically presented at one point to the emergency department because his blood pressure was so high that he was having blurry vision, you know. The idea is that if your symptoms are that bad or they're new, he'd never had blurry vision before that. That was the first time he's had blurry vision. And we found out that he had elevated blood pressure, and that was the solution for it. And he underwent the testing and imaging that he needed. But the thing here that I want to talk about is what is new? Is it something that changed from before? And I think that that's our biggest flag.
That is that is probably pertinent information. That's probably the key tag. So thank you again for sharing that. The next question I want to ask, if you don't mind, is around medication. I know my grandfather, he passed, and it was cardiac, cardio assimilated, and but he wasn't taking his medication as the doctor required for him to take the medication. And can you just talk through how important it is to take your medication in the manner in which the doctor spoke to?
I know that as healthcare moves forward, we feel that it's very easy for physicians to just prescribe medicines and just throw in pills. And a lot of the times I agree that we don't do a great job at making sure that is the patient going to be comfortable with taking so many new medications, especially when it comes to the heart, because I know with heart failure and other heart problems, it's typically four or five, six medications a day sometimes, you know? And so reiterating how important they are is extremely important, but also knowing that they're comfortable with it and what is the option that they would rather take versus not. Can we put them on a medication that is taken once a day rather than a medicine that they need to take twice a day? Things of the sort, you know. I think we need to do a better job at trying to optimize these things. But I also believe that those medicines are extremely important. Now, here's the caveat to what I'm saying. Medications without adjustment of change of lifestyle at best are effective up to 60%.
Mm.
And I'm going to give you an example from the stroke world. And this is something that I talk about with my stroke patients, and that is if you experience a stroke, we're going to start you on a cholesterol medication. We're going to start you on aspirin. We're going to start you on, we're going to take care of your diabetes a little bit better, more strictly. So we're going to start you on all of these medications. If you continue to smoke, your risk of stroke will still be 70%, even though you're taking all of the medicines. So it's truly a combination of all of them. So taking the medicines and making sure that we adjust our lifestyle.
Yeah, so talking to the lifestyle, but it also sounds like listening to your body as well and how it's responding to the medication, and then advocating and talking through like maybe is there something that can modify it, but ultimately lifestyle as well as listening to your body and then the medication. Thank you so much for sharing that.
I just want to just make a comment about listening to your body, and yes, we all know our bodies fairly well. We've lived with them our whole lives, right? But it is also something to keep in mind that sometimes our body doesn't give us the signs that would give us a hint towards if something is going wrong, you know. And that's basically that's where the common phrase about sugar and salt being deadly killers, you know, silent killers, because they can cause all your problems and symptoms without you necessarily like knowing about it. But yeah.
I think that is our last studio question. Thank you so much for, wait, one more hand, hold on. Okay, Philip, I'm coming. I'm running in heels, doctor, just to let you know.
Take your time.
Okay, so what can the community do to support research or sort of give the behind the scenes support to you so you can continue to research and give us this type of great information?
Thank you for asking that question because we are living in a time where access to those resources is extremely limited. And I think that the first thing that we have to do is raise awareness about